Okay, the pathology or the lesions associated with the ninth and the 10th nerves. Okay, so what's gonna happen if you have an isolated lesion of the ninth nerve? You have something which is called a loss of gag reflex only. Now, what is gag reflex? Okay, so basically, remember the oropharynx is the sensory component of the oropharynx is from the ninth nerve. Okay, so basically, if you touch the oropharynx, imagine this is a guy from his side. Oh, terrible, very bad. Okay, imagine if this is a guy, and I'm very bad at drawing, by the way. Oh, this is the mouth. Imagine if this guy is like this, somewhat like this. Okay, this is a mouth, and like this. This is the guy from his side. Okay, and this is the oropharynx. So if you touch this oropharyngeal region with a, let's say, a tongue depressor, this sensation is actually detected by the ninth nerve, which then feeds back into the brainstem, has a relay with the vagus, and the vagus, remember, the vagus supplies the pharyngeal muscles, the palatal muscles, the muscles of soft palate, and everything else. So this motor component is from the 10th nerve, and the sensory component is from the ninth nerve. Remember. So what happens is, ninth nerve detects it. The 10th nerve says, okay, elevate the pharynx and larynx. This is a gag reflex. Okay, this is the gag reflex. So you have a loss of gag reflex if you lesion the ninth nerve. So, or also if you lesion the 10th nerve, you'll also have a loss of gag reflex. Okay, so how are you gonna tell them apart, which is which? Well, ninth nerve produces a loss of gag reflex. Okay, but 10th nerve also has something else associated with it. Imagine this guy is opening his mouth like this. This guy is opening his mouth. Ooh, it's a very big mouth, and you have a uvula over here. Okay, so remember, if you have a 10th nerve pathology, you'll also lose sensations. Oh, sorry, the function of the palatal muscles, the soft palate from that side. Let's say you have a loss of soft palate over here. So what's gonna happen? When you tell the patient, say, this palate is gonna elevate, and well, these muscles are gonna constrict, these muscles are gonna remain flaccid, and the uvula is gonna point towards which side? Away from this side, like this. The uvula is gonna elevate like this, and the uvula is gonna point like this. Okay. Once the palate elevates, the uvula will point towards the affected side, away from the affected side. Okay, so this is how you tell them apart. A ninth nerve lesion will not produce uvular deviation. Okay, also in 10th nerve lesions, you'll have other pathologies, other symptoms associated with them. One of them is hoarseness of voice, because it is controlling the muscles of phonation or vocalization. The laryngeal muscles, the vocal cords, they're controlled by the 10th nerve. So you'll have hoarseness of voice. Okay, so these are the basic pathologies which can involve the 9th and the 10th nerves. What else? Is there going to be anything else if you have 9th and 10th nerve losses? Okay, you'll have a loss of gag reflex, and you'll have hoarseness of voice, basically. By the way, you know any surgeries which can actually damage the 10th nerve? If you're saying thyroidectomy, you're absolutely correct, because the 10th nerve, the recurrent branch of the laryngeal nerve, which is a branch of the 10th nerve, actually passes very near the thyroid gland. So if you remove the thyroid gland, there is every possibility this nerve is going to be damaged. Also, there is a medical condition which can actually cause 10th nerve losses. One of them is lung cancer. Okay, lung cancer likes to infiltrate into the 10th nerve. Okay, so if it infiltrates out of the lung, then the 10th nerve is traveling next to the lungs, so it infiltrates into the 10th nerve, and it causes hoarseness of voice, loss of gag reflex, and also something which is very important. Remember, loss of vocal cord approximation will also cause a lot of aspiration. because 10th nerve, remember, if this is the larynx and these are the vocal cords like this, 10th nerve actually brings them together. If you have, and this is what protects when you swallow and the vocal cord actually approximate with each other. This is what protects the food, one of the factors which actually protects you from swallowing the food or saliva or anything else. So that's why we say do not talk with your mouth full, because when you're talking, what happens, your vocal cord will actually be approximating like this, probably moving outwards, inwards like this, so you don't swallow. Then the 10th nerve is actually involved with closing the vocal cords. So if you are not able to close your vocal cords, you'll aspirate. You can aspirate, okay, and you'll actually suffer from some aspiration pneumonitis or something else. So this is the basic function of the loss of the ninth and 10th nerves. Basic pathology associated with the loss of ninth and 10th nerve. Okay, this concludes our lecture on the ninth and 10th nerves.